Hi, everyone, and welcome to the SRHM Podcast, which explores new research and emerging trends in the field of sexual and reproductive health and rights, with a focus on using rights-based knowledge for action.
Hello, good morning, good afternoon, good evening for everybody's listening to the SRHM podcast. I'm Eszter Kismődi, Chief Executive of Sexual and Reproductive Health Matters, and I'm very, very pleased to welcome today here dear colleagues from ACORCA, African Coalition for Research, Communication and Abortion, whom I most recently met at the ACORCA launch in Colombia, Bogota at the ICFP conference. So very nice to see you, and I go one by one and meet you, Naa Dodoo, who is a co-chair of ACORCA and Director of Human Capital Development at the African Institute for Development and Policy. Very nice to welcome you here, Naa.
Thank you.
So I'm also welcome to introduce Ramatou Ouedraogo, who is a research scientist at the African Population and Health Research Center that is a founding member institution of ACORCA. Welcome, Ramatou.
Thank you, Eszter. Glad to be here.
And also very warm welcome to Béniel Agossou, who is a medical doctor and technical advisor in health system at the center ODAS and an executive committee member of the coalition. Welcome, Béniel.
Thanks, Eszter.
So I'm turning to you now, and can you please tell us about what is ACORCA and what inspired its creation? Can you share some words about the core mission and the vision of ACORCA?
Thank you. Thank you so much, Eszter. So ACORCA is a newly formed coalition and is the African Coalition for Research and Communication on Abortion. And the reason why ACORCA was formed was actually two sets of reasons. First of all, because there's like a really big public health agency needed for credible abortion research in Africa, and not just research, but then also research translation into policy, into really changing practice on the ground. The second reason is that for a very long time, this kind of research work on abortion in Africa has been driven mostly from the global north. And so several institutions, there are 16 founding member institutions. And what we thought was that it was really important that we transform this model of research and communication on abortion, really bringing the control down to be owned by Africans, driven by African institutions, including with managing the funding and determining the priorities for research, and that we are also at the same time building research expertise, because a big reason why we don't have Africans driving the research is that we don't have enough expertise. So building research expertise of young people, of young researchers, even older researchers, so that we can drive research, do research, conduct research from the continent. So I'll talk very briefly about our vision and our mission. So in line with what I have just explained, our vision is that we want to see an Africa where every woman and every girl has access to safe, high-quality abortion services. They are free from stigma, and every woman, every girl is enabled to exercise their full reproductive rights with dignity and autonomy. I know that's a little long. And then our mission in line with that is to really advance policy-relevant research, like I said, evidence-based advocacy, and partnerships that will drive this transformation in policy, practice, societal change for equitable and safe abortion access across the continent. So that in a nutshell is why we are and what we aim to do. Thank you.
Thank you so much, Naa. And for our listeners and readers, it's very obvious that you founded ACORCA in a very, very critical political momentum. Then when there are ideological attacks and political attacks, fundraising, funding withdrawal from sexual and reproductive health and rights, there are particular attacks against abortion rights around the world and in Africa as well. So just following on you, Naa, I'm turning to Ramatou, and can you go a little bit deeper? What are the critical issues related to abortion in Africa today? And in particular, based on your mission, and what role does evidence-based research play particularly in shaping laws, policy, service delivery, and public opinion?
Thank you, Eszter. So in Africa currently, the critical issues around abortion are issues around access and the safety of the abortion services, because most of the countries in Africa, especially sub-Saharan Africa, have very restrictive laws that prevent women from seeking services in the health facilities. So they are forced to resort to unsafe procedures, leading to complications, severe complication, and in some cases death. And we know that abortion accounts for 10% of those maternal deaths in the region. So those are the critical issues. And also we know also that stigma of abortion also plays. So even when the women met the condition to access the services under the restrictive ground, they still fear those stigma, or they don't also know about the right that they can access those services. So they end up using those unsafe methods and facing complication and death, as I mentioned earlier. So evidence definitely are critical, are important to framing legal framework, to getting policies in place, because research shows often is that if you take, for instance, the incidence of abortion surveys, often it shows that the legal restriction doesn't prevent women from accessing services, because unintended pregnancies, that the drivers of unintended pregnancies would always be there and leading to unintended pregnancy. And when they face unintended pregnancy, the legal framework cannot prevent them from seeking services. What it will prevent them from is to seek safe services, to get safe services. So the incidence of abortion survey and safety would show then how many access abortion services, how many end up with complication, how many die from those complications, and also how the fact that the abortion is not allowed in those countries lead also to a continuum of vulnerability, because if a woman resorts to unsafe procedure, it means that she's likelihood to miss the opportunity of receiving counseling and preventing her from getting unintended pregnancy again. So it also builds that continuum around. So those studies help the policymaker to see how the legal framework is not preventing abortion, but rather putting women's life at risk. And in case countries like Benin, where abortion, the government really voted a groundbreaking law to open the ground for accessing safe abortion services, including social ground. It's getting evidence on the incidence of abortion, for instance, could help track, and the safety could help track progress on how such kind of law is able to reduce the unsafety, to reduce the complication and death that are related to unsafe abortion in the country. So basically it helps policymakers to rethink about their laws, about their policies, and refine them as the Benin government did. And also, if you take studies around the availability of and quality of services, it also helped the government and the policymaker to understand how available are the services, how are they able to meet the client, the women's need, and how the quality is. So that if some are not able to access, they're able also to equip the facilities also to offer. So in a nutshell, evidence really drive, because that's what will help policymakers to see what is in the ground, what are the realities, and then refine the laws based on that. Thank you.
Thank you so much, Ramatou, and I'm so happy that you mentioned both the restrictive environment, but also recognize that actually policy, legal reform, decriminalization, expanding legal grounds did happen in Africa and around the world. We know that more than 60 countries actually liberalized abortion laws in the past 30 years, Ethiopia, Benin in the region, South Africa earlier. And it's 2003 when actually WHO published the first ever evidence on what you just mentioned, Ramatou, that the legal ground doesn't influence access to services. It's the same. It's more about the safety and unsafety, and it's not about women seeking abortion. So Béniel, I'm turning to you and asking you that take forward just what Ramatou said, and can you talk about specifically how does ACORCA address these cultural, legal, and health-related barriers that Ramatou just explained in relation to safe abortion? And can you possibly share example of successful initiatives or projects of ACORCA that ACORCA members have led or supported? And too many questions at once, but I also would like to acknowledge that ACORCA, like SRHM, you are truly functional in bilingually, in English and French, and it's so important from a regional dynamic perspective. So, Béniel, many questions in one question, and over to you. So about successful initiatives, what do you do? And a little bit about the Francophone Africa, French-speaking Africa angle as well. Over to you.
Okay, thank you so much, Esther. So, ACORCA works in multiple ways to tackle cultural, legal, and health-related barriers to safe abortion. I will talk about the two first ways. The first way is called research. Our network of researchers produce evidence that expose these barriers and shine a light on the real challenge women face in accessing safe care. For example, you have one of our partners in Rwanda, HDI, who recently conducted a study showing that despite the progress on abortion law in Rwanda, many young women still resort to unsafe methods. So this study, for example, showed that legal reform alone is not enough. Women and girls need to know their rights, understand their service option, and be empowered to make healthy decisions. So also in the way of research, we know, for example, that task sharing policy, self-managed abortion, ways to be sure that all women and all girls can access to safe abortion. So we have a lot of data that some of researchers of the coalition produced in countries like Ghana and South Africa. The second way is folk advocacy or communication. Because if we have data, before data be used in policy, we have to communicate this data. We have to use them in advocacy. So in the network, you have some organizations who are strong in advocate. Advocates in our network use the evidence to engage policymakers and the media, pushing for policy and practice reform. For example, at the Centre Audace 3 months ago with HDI, we convened ministries of health and scientists from 12 countries in Francophone Africa to ensure that data-informed decision making. And 6 weeks ago, we hosted the regional dialogue for safe abortion in Francophone Africa, bringing diverse stakeholders to map pathways for progressive policy and practice change. It is essential that research producers and research users sit at the same table. So we ask the right question and ensure evidence is used for social good. Yes, so that is the way we use as ACORCA to tackle cultural, legal, and other barriers to safe abortion. Thank you, Eszter.
Thank you, Béniel. And in terms of the Francophone Africa angle, can you say a couple of words about how you function bilingually? How do you decide about the bilingual functioning and how does it work?
Yes. ACORCA is totally bilingual because we see that Francophone, Anglophone Africa, we face same challenge about abortion, access to abortion, and we need to go beyond lingual barriers and learn each other. Anglophone Africa have to learn from Francophone Africa. Francophone Africa countries have to learn from Anglophone Africa. And the lack of evidence, lack of data, we notice that is very critical in Francophone Africa. So in the coalition, we ensure that each language brings its contribution to have one Africa, to be more in solidarity. And in the governance of the coalition, you can notice that there is Francophone members, Anglophone members, and yes, thank you so much, Eszter.
Thank you so much. So that leads to my more practical questions also for the listeners. And that, can you talk, Ramatou, a little bit about the organizational setup and also who are the key stakeholders you are working with both regionally and nationally? Ramatou, over to you.
Thank you, Eszter. As Naa mentioned, ACORCA is really meant at bringing together different stakeholders working on the issue of abortion in Africa. And in line with that, I don't know if whether she mentioned, the funding members were mainly research organizations to start with, including also the Sound Orders, who is an evidence user on the other end. So we had research organization, academia that came together for the funding. That was the basis. And then for the rest, ACORCA is open to, I would say, all type of stakeholders working on issue of abortion, whether in terms of research. So it's welcoming organization, it's welcoming individuals who are working on the issue of abortion, doing research on the issue of abortion. It's also welcoming people who are communicating, who are using evidence users to make policies, as we all mentioned. So in line with that, all organizations that are offering services, that are doing advocacy around abortion, are also welcome and becoming members. I know during the ICFP, we got many people who showed interest, and they were not only researchers, because often people think it's a research related only initiative, but we told them that it's open to everyone, to advocates, to all people who are interested and open to improving access to safe abortion in Africa. So that's what I will say regarding.
Do you also work with governments, for example, who are not necessarily in the advocacy side, but those who are in a position to change laws, policies? Not only the government, but parliamentarians as well, or human rights commissions or other stakeholders. So are you also working more other state stakeholders as well, and how?
I would say yes. Now and Béniel can come in and correct me, because it's really about interest. It's really about being motivated in changing things. So governments, including ministries, department or parliamentarian, whether their organization or as individual, can also join the initiative in line with that. So yes, it's open to both those who are advocating from the civil society side, I would say, from the research side, but also those who are coming up with the law, those who are implementing policies. In that, I'm thinking about government, I'm thinking about parliamentarians, as you mentioned. But Naa and Béniel can chip in to add more on that. Thank you.
Thank you. So now looking into the future and about how to work with ACORCA. So turning back to you, Naa and Béniel. So now first to you, that what are your strategic action plans for the next 2 years? And then I will turn to you, Béniel, to ask that how others and all of us can engage with you. So first to you, Naa.
Okay, thank you so much, Eszter. So for the next 2 years, like we said, we are quite new. And so we spent the past year setting up our structures. Our secretariat is based in Rwanda in HDI, the Health Development Initiative. And we are getting on a few key staff who will continue to help us drive the work. But even more critically, we will be spending some time within the next year working in a few countries, identifying national research priorities for abortion. And this is going to be collaborative. So just as Ramatou mentioned, it's not just with us research institutions or advocacy institutions, but also with governments, with ministries of health, etc. So national research prioritization is an important thing. And then also we have a bit of money to do some research in a few countries within Africa. Another very big bucket of things that we want to do is really expanding the capacity, methodological, technical capacity of researchers on the African continent to conduct research. And so we've already established a webinar series. We are going to continue with that. And the recordings are available on our website. We are putting together a compendium of different toolkits, materials on abortion research communication that we'll make available in English and in French. We have a knowledge portal on our website that we are going to make available so that you can just come and find out what's happening, what tools you can use, etc. And then importantly, we have a small grant scheme that we piloted in 2025. We are going to be doing a little bit more of small grants to young upcoming researchers who will also receive mentorship from experienced abortion researchers so that they will be able to really be more established. And just to say that all of this is undergirded by having enough funds. And so fundraising is a really big critical thing that we need to continue to do. And so even as much as we are calling on researchers, on advocates, on government, we are also calling on individuals, organizations who have access to funding to come and support this, because the funds are critical, especially in this era, to be able to achieve these aims. Thank you.
Thank you, Naa. So, Béniel, we are very excited from the SRHM side to work with you and with all the collaborating institutions whom you are working with, publishing more articles, blogs, podcasts, conversations. We also have a Francophone Africa language edition that operates in French, including providing mentoring. We are introducing practice pieces in the journal that can also shifting the hierarchy of evidence when the evidence creation and knowledge creation shouldn't just belong and research to highly academic institutions, but also for service providers, for those who are doing amazing policies and programs and document also community voices. So from SRHM perspective, we are very, very excited to work with you both in English and French and looking forward to our collaboration. But how others can work with you? What kind of collaborations and engagement are you looking for?
Thank you so much, Eszter, and thanks to SRHM for the collaboration. So there are several ways to get involved. First, for researchers should not only generate evidence, but also join forces to strengthen the capacity of young researchers across Africa. This will help to have a very strong next generation of researchers on abortion. So mentorship and collaborative projects between research organizations, researchers are essential to build a sustainable research ecosystem. Researchers can also help fill critical evidence gap, such as abortion incidents, the impact of policy change, and strategies to overcome stigma. for advocate, NGOs, program manager. They have also main role beyond advocacy. We need them to help identify research priority and actively contribute to data collection and analysis. This collaboration between researchers and advocate, program manager will ensure that evidence reflects real world challenge and inform effective policy and program design. Everyone can join the coalition as Rama and Nase or support our work by visiting our website, ACORCA.org. And finally, I think we can all mobilize resources for African-led research and community initiative. This is essential to ending preventable abortion-related deaths. So, yeah, thank you, Eszter.
Thank you so much, dear Béniel, Naa, and Ramatou, for this very rich conversation. We are really, really looking forward to work with you and encouraging others to reach out to you for information. The podcast is available on our usual channels, also on our blog piece, where we are sharing further links for ACORCA related information and further resource materials. Thank you very much, Naa, Béniel, and Ramatou, and thank you for everyone listening. Goodbye.
Thanks for joining us for this insightful conversation. Please check the show notes for a link to the SRHM Journal, which is available online and open access. Follow us on social media and sign up for our newsletter to receive notifications for new publications. If you're enjoying this podcast, please subscribe, give us a rating, or leave a review. Sharing evidence-based and rights-grounded knowledge is our passion, and it's also critical to support the advocacy and actions that need to be taken to improve SRHR for all. We would very much appreciate it. Thank you for supporting the SRHM Podcast, which is produced by our staff. The music was composed by Tiber Christian and Salomon Beautombe.